Hi, my name is Dr. Shellie Goldstein. I'm an acupuncturist specializing in cosmetic facial acupuncture. And I would like to thank the American Acupuncture Council for allowing me to be here today. It's always a pleasure. Today's presentation is the anatomy of facial aging. This is actually very important, particularly for cosmetic facial acupuncturists, because although we're practicing traditional Chinese medicine, we always need to take into account the anatomy of the face and the way that it changes over time. So this presentation is almost the foundation of our set skills and being able to get great results when we practice. We will start with the Western medical perspective. In this lecture, we'll discuss facial anatomy and then also the morphological changes that occur as the face ages over time. And then we will touch on Eastern medicine acupuncture strategies for treating the aging face. And throughout my series with the AAC, we will break these down into smaller formats and address them individually. But today is just an overall of what you need to do in order to understand other lectures. When we think about facial aging from the perspective of Western medicine, we're really talking about this biological process that happens with the resulting of a gradual reduction in the structural component cell function. In Chinese medicine, we think more in terms of the qi and the energy and the organ systems. Whereas from a Western perspective, we're really going to look at the anatomical features of the face and then the morphological changes that we see as the face ages over time. And when we think about a young face, it has a normal volume, nice and full with very well-defined contours along the jawline and the cheekbones, that type of thing. And then as we age, these regional facial aesthetics, these units that we're talking about, begin to change. And from a Western medical perspective, those changes are mainly due to a number of factors. Resorption of the bone, fat tissue changes, muscle attenuation or the changes that occur with the muscles of the face, and then the skin. The skin gets thinner, the skin gets flaccid, it develops elastosis, and then we have ligaments in our face that we'll talk about, and as those shift, they also reposition the soft tissue that it attaches to. When we look at the facial planes, we look at them in two different systems. We look at them horizontally and then we look at them vertically. So horizontally, we talk about the upper face, which includes the hairline, the upper hairline to the inner canthus area at the top of the eyebrow. And the mid-face is referred to from the inner canthus plane to right below the nose, the subnasal. And then the lower face is considered right below the nose to the jaw area. And then we look at them from a vertical center line as well. So we have the very center, the vertical center line, and then moving out to the center of the pupil is the next vertical line. And then the third vertical line is right in front of the earlobe. So we go from upper to middle to lower, upper face, mid face, lower face, and then from the center line, moving out to the center of the pupil and then directly in front of the earlobe. And these are fairly standard. There are obviously some changes that occur with different types of faces. So say a Caucasian face may have a narrower nasal base and a larger tip projection. That intercanthus area widens when compared to other faces. Whereas an Eastern Asian face is going to have a very somewhat weaker facial structure framework. It's a little more delicate. It's a little wider, a little rounder. The eyebrows are a little bit higher. The lips are a little fuller. The nasal bridge is a little bit lower. And then the flaring of the nasal alia exists more with an Eastern Asian face. And then the malar prominence in the mid-face, this malar area right along here is more prominent. Lips are more protuberant. And then the chin is a little more pushed back or receded. For a Latino or Hispanic face, typically the bizygomatic distance right in here is a little wider, the maxillary protrusion is a little wider, the nose is a little wider, and then the chin is a little more receded. And then an African American face has a much broader nasal base, a decreased nasal projection. The bimaxillary protrusion exists where the orbital is a little more protosis, a little bit lower. And then the tissue is a little plumper, a little bit softer. The lips are a little more prominent, and there's an increase in facial convexity. So there are somewhat changes, although we're still dividing them up along the same trajectories, both horizontally and vertically. When the face ages, it moves from, when you think of a young face, it has a very wide upper, remember, upper face and upper mid face, and a more narrow and pointed lower face. And when we look at a younger face, what we see is our eye goes directly to the upper portion of the face. So we look at eyes, we look at a very high cheekbone, we look at a nice wide area in the upper face and the upper mid face. And then as we age, it moves, the weight of the face actually moves. It drops and then becomes more medial. So that, in this case, as with the aging face, the weight of the face actually moves down. We start to lose, you can see along here, we lose the definition along the jaw area, and the weight of the face moves from, say, upper and outer, so it's up and wide, to more medially and flat. This creates a lot of changes in the face, and we're going to look at that right now. We know we have bone, and then above the bone we have soft tissue. And in order to really get effective treatment results, we really need to understand the relationship between Eastern medicine and the biomedical anatomy with regard to the morphological or the psychodynamic facial changes over time. So let's break these down and let's look at them as they exist from bottom to top. So deep to the surface, we have bone, the basic structure of our face that holds the shape of our face. On top of bone, we have muscle. On top of muscle, we have fat. And then superficially, we have skin. So let's look at them. Let's look at what happens with bone first. As we age, bone resorbs, which means that it starts to break down. And it breaks down from the openings that exist. So for example, the eyes get a little bit wider. The eye socket gets wider. And we're looking at this both. This is a CT image of two females. This one on the left, she's between 20 and 40. This is someone who is over 65 on the right. And you can see in the earlier one, you can see a nice squared face, open eyes. Here's the nasal bone. And it's nice and thick and full. And look what happens over time. The openings start to open up and get wider. As the face itself starts to get smaller. So the openings get wider, the skull itself starts to shrink, so it gets smaller. You can actually see it starting to push down. When the skull starts to push down, what happens? You lose the form. So the mid area, the maxillary area gets shorter. The mandibular bone, the mandibular area starts to break down too. It starts to push forward. So you can actually see this rotation, this inward medial rotation of bone, that you see changes in dentation. And so we see the height of the face starts to decrease, the eye sockets start to expand, you get temporal hollowing. Here's the temple. This starts to break down and get hollow. The piriform, this is the nasal piriform. This is the openings that we were talking about. The nasal piriform gets wider. And we get the resorption or the breakdown of the mandible right in here along the base, the maxilla on the top. And then this causes changes in your teeth, changes of the indentation. It starts to push forward. And then the entire face starts to rotate and protrude. And this is what it looks like. What we begin to see is eye sockets start to increase. The nasal piriform starts to widen. The mandible in here starts to shorten. The mandibular length starts to lengthen and shorten as well. The nose starts to change. And the maxillary area right in here, this angle starts to get change. You start to see changes in the height of everything, which pushes the teeth forward. When that happens, this is what you see. So the darker areas is where the bone is starting to break down. What happens to all of the soft tissue on top? All of that tissue starts to, it's losing its support, it's losing its underlying foundation. So even in a healthy tissue, it's going to start to sag. It doesn't have the foundation anymore. So it starts to sag and drop and move medially, as we saw. Um, on top of bone, we have muscles. Now, the face is unique. The face has two types of muscles. It has superficial muscles and it has deeper muscles. The deeper muscles generally attach, like on the body, from bone to bone or bone to muscle. And the deeper muscles in the face are primarily located in the mid face, this mid area, and they're designed to move bone and its attachments. So primarily what we're talking about is the mandible. The mandible is the only loose bone on the body. Everything else is connected. And so the main purpose of the deep muscles of the face is actually to move bone, and it's primarily for chewing, for moving the mandible back and forth and for chewing. Now, the muscles on the superficial muscles are a little different. We call them the muscles of expression or mimetic muscles, mimetic. And these muscles are different than the rest of the muscles on the face and the deep muscles of the face and on the body. The mimetic muscles are designed to move other muscles and move the skin. So rather than moving bone or bony attachments, they're going to move muscles and they're going to move skin. They're very flat. You can see them in this cadaver. Here's a mimetic muscle right here. There's one around the eyes. There's one here in the cheek area. Here's one right here, and then around the mouth, and then the platysma muscle along the neck. And with age, rather than atrophy, they attenuate. So what does that mean? We think of muscles atrophying over time, and it's mainly from lack of use. But when you think about the muscles of the face, we use them all the time. We use them with our expressions. We use them when we talk. Our eyes, they're opening and closing all the time. We are constantly using the muscles of our face. So they don't really atrophy. They attenuate. And when we say attenuate, what that means is they get shorter. So they reduce in their amplitude of movement, and they get stiff and straight. Instead of being nice and flexible and moist and resilient, they start to straighten, they start to stiffen, they get stuck, or they reduce in amplitude so they don't move as well. And that limited amplitude of these mimetic muscles leads to a more permanent or a more contracted position. Whereas if you look at an aging person, it looks like their muscles are frozen. They aren't moving. They aren't moving back and forth or contracting and relaxing. They're kind of stuck in their position. And when these muscles get thinner and tighter and stiffer or straighter, the skin on top of them starts to crease, starts to fold. We start developing facial asymmetry, and we get wrinkles. So a lot of this is combining the changes in structure in the bone, plus the changes are the attenuation of the mimetic muscles of the face. And then we see systemic changes in the integumentary system. The integumentary system is made up of 3 layers. It's made up of the subcutaneous, or the fat layer. It's made up of the dermis, the mid layer, and it's made up of the epidermis, which is the very surface area of our skin. It's what we see when we look in the mirror or when we look at each other. Let's start in the deeper layer, in the subcutaneous, or that fat layer. We have two layers on the body of the face. We have the deeper layer and we have a more superficial layer, and they look different. You here in this cadaver, we can see on the surface of the left side, this is it's a little lighter yellow color and it sits on the surface, whereas the deep fat is a little darker in color and it's deeper underneath the surface of the skin. Regardless, we see that as we look at the face and as we look at the fat in our face, the fat is what provides the structure or the plumpness of our face. Some people have more than others. As you can see, I don't have a lot. But they're all of these fat pads, we think of them as being all across the face in a uniform position, but in fact, that's not the case. They are actually separated by ligaments. So they're partitioned and sectioned off and held into place with ligaments. As we age, changes occur, and the fat, we call it descent and deflate, which means that it moves as it breaks down. It starts to lose its form, it loses its integrity, and then it moves. And oftentimes it moves under the eye socket and in this fold between the nose and the corner of the mouth. It's called the nasolabial fold. And we see as people get older, this area begins to thicken. It's not a wrinkle. It's actually partially due to the movement of the tissue and the muscles medially towards the nasolabial fold. But it can also be due to fat right in here that is moving from the center of the face into that area. And it's also due to just simple loss of fat in the mid-face area, so that we see a flattening or a deflating in the mid-face area, but then we also have the illusion of being thicker in the nasolabial fold. Also, what we see as changes in the upper area, the forehead, the periorbital area, the temporal area, we start to see a breakdown of fat into this area, and then some of this also lands along the jaw area. And that is partially what happens when we start to lose our jaw area, or the cut that we see in our jaw area. We may think that it's all skin that is starting to fall down, but in fact, some of that may be due to fat buildup along this jaw area that creates that asymmetry from side to side, but also that loss of definition in the jaw area. On top of the fat layer, or the adipose tissue of the deeper areas, we see the dermal layer. The dermal is right here in the middle, and then on top of that is the epidermis. In the dermal area is where the health of the cells develop. Cells begin their growth cycle at the base of the dermal area, and they begin to float up. They're bathed in this nutrient of hyaluronic acid and fluid, proteins, vitamins, everything that we need in order to create healthy cells occurs in the dermal layer and floats up to the top, moves up to the dermal layer, the epidermal layer, and then sheds off. So not only do we have a number of nutrients and bathing solutions in this dermis, but we also have our erector pili muscles. They're muscles that we feel when we get the chills and the hair starts to stand up on our skin, sweat glands, a number of sebaceous oil glands, a number of different vital substances are in the dermal area of the skin. It's composed of a papillary layer, which is a loose meshwork of thin connective tissue, and then the deeper area is the thicker layer of connective tissue. And if you look in this side image, this is connective tissue. We'll go into this a little more deeply, but it's a very loose matrix, a loose structure, whereas the lower area is a little bit thicker. And then on top of that area is the epidermis. Then remembering the epidermis is that very surface layer of the skin. It's made up of a number of different layers, 7 different layers. On the very top are dead cells. They're filled with keratin. It's what we slough off when we exfoliate our skin. And then as we move deeper to the dermal layer, the cells are a little bit healthier. They're a little bit plumper. They're a little thicker. They have a little more moisture in them. And then as they move through the dermal, cells move through the dermal layer into the epidermis, they start to thin out, they start to flatten, they lose their moisture contacts. And then at the very surface is the dead keratin cells. As we age, a number of things happen. One is the health of the cells that are floating up from the dermal layer up to the surface. The cell health in the dermal layer starts to change. We start to lose the water content. They start to be a little thinner, a little drier, so they're not as healthy as they move up to the surface. Also, the structure of the dermis. Remember we spoke about that connective tissue? That connective tissue starts to lose its integrity. Collagen and elastin are the main components that hold up the integrity of the dermal layer. When that starts to become disorganized and break down, we actually lose the integrity of that entire dermal layer. Think of a mattress that's thick, and as we lie on it over and over and over, it gets a little bit thinner, and we lose the integrity of our mattress over time. We lose the integrity of that dermal layer, and then cells on the top are thinner, they are drier, they're less subtle, they're less plump, and the entire area sinks. So here's the mattress, here's the sinking of the skin in the mattress, and it looks like they're wrinkles, but in fact it's just loss of collagen, loss of integrity, and skin aging on the surface of the skin. Remember that, and then in that connective tissue, so connective tissue is throughout. Fascia is a type of connective tissue, and it is the most abundant form of collagen fibers in the tissue of the skin. There's deep fascia on the face, which attaches to the bone, the lining of the bone, the periosteum, and it encapsulates and protects the muscles and the deeper layers of the tissue. And then there's the superficial, and that superficial is like a thin layer of, say, sticky film or saran wrap. So it's a little sticky and it attaches to the muscles, and then the muscles attach to the skin, and every time a muscle moves, it causes the skin to move, and that's how we get our expressions. And then all of these are in a horizontal plane, and then running in a perpendicular plane are our retaining ligaments. There are a number of different retaining ligaments in the face. Remember, they surround and encapsulate fat, but they also are like little plugs. They hold all of the loose tissue that's running in a horizontal plane. They hold it all together. So what happens as they age? They start to attenuate as well. They start to dry out. They start to get thicker. They lose their integrity. And as all of the horizontal tissue starts to shift, starts to dry out, remember, turn more medially, these retaining ligaments start to move as well. So again, everything moves medially. And again, we start to lose our malaprojection. And this is what we see. So if you look at this, this is on this end. To the left is aging as a young face from the frontal and then side views. As we age, we can start to see shortening in the forehead. We start to lose or flattening in the mid face, and then loss of definition along the jawline, as you can see. So let's look at this. So here is a younger face, right? See the height up here? Eyes wide open, forehead nice and relaxed. Now look, this is what happens as we start to age. Remember, everything starts to drop down, move more medially. We develop that nasolabial fold. We develop along here the repositioning of fat, loss of structure. Everything starts to fall and lose its shape. Here we see this side is a younger face. B is the older face. Can you see how the mid face starts to flatten? We start to see a deeper nasolabial fold. We start to see loss of collagen and elastin, particularly around the mouth, and loss of definition along the jawline. Here it is again. Here's a younger face. Here C is the older face. Deepening in the nasolabial fold, loss of definition in the jawline, the corners of the mouth start to turn down. This is another conversation about muscles and the effect that muscles have on the face, particularly the mimetic muscles. And then in terms of treatment, how are we going to treat this? We see this changes starting to happen. We see the changes that are starting to occur. Some that you can change. You can't really change bone loss. The faces that have already lost some bone, it's very hard to change, but we can make a big difference. And we can do that with our acupuncture treatments. So in the Ling Shu, there are numerous discussions about needling guidelines specific to the layers of the face, the skin, the flesh between the areas between that flesh, in the channels and around the muscles at the level of the bone. In the Ling Shu, they talk about the skin, the flesh, the muscles, the tendons, and meridians all occupy different places in the body, and that different diseases respond to different methods. And when we talk about diseases, in this case, what we're talking about is aging. And if illness or aging is superficial, the different needling that we do, it will penetrate and injure the good flesh. If we do not treat it at the superficial layer or we miss it, then we're not going to get the right results that we want. So when we treat, what we're treating is, we talk about the superficial layers, we're talking about the epidermis and the dermis. So when we're actually treating them, we have to angle the needle in a way that we're actually treating the epidermis and the dermis. So we're actually lying that needle very flat. When we talk about angle of insertion, what we're talking about is relative to the skin surface. So we would lay that needle right at the surface of the skin at, we say, 5 to 15 degrees. And we can treat the superficial wrinkles. We can treat skin atrophy, pain. There are a lot of pain receptors in the dermal layer of the skin. And so we can actually help treat pain by laying that needle in a very, very superficial layer. We can use it with intradermals. A Japanese style of acupuncture is very good for addressing, for our purposes, introducing Japanese acupuncture to treat the epidermal or the dermal layer of the skin. If we want to move a little bit deeper into the hypodermis, or the fat layer, we're going to angle it a little bit deeper, not much, because remembering, if you actually place your hand on the surface of your skin, if you push a little bit, you're already at the bone. So this is very, very superficial, very shallow. So we're going to angle the needle at a 15 to 20 degree angle. We use it for skin atrophy, for any type of fat atrophy or deflating. It's really good for prevention. For aging, on the deeper channels at the muscle, if we want to address the muscle layer, we're going to angle that needle in a 45 to 60 degree angle. Really good for treating muscle attenuation, trauma, muscle trauma or prevention. And then for the bone, we're going to go right into treating the meridians. We're going to go at the angle of the bone, which is a more 90 degree angle. So that's also great for prevention, any meridian problem or trauma to the face. So here's an example. This is a different protocol, or a protocol. This is just an example of how we might use into the muscles in the neck area at a 45 degree angle. If we're going to treat the meridians, we might go right into the acupuncture points on the face. A shallow needling into wrinkles and into the dermis and the epidermis. Treating the muscles, the corrugator muscle, you can see this deep corrugator fold, and then 90 degrees into the meridians. And this would be a before and after picture of what you can expect to see, say, in this is a 10 treatment series. So that's it for today. There again, I have a number of different lectures for you where we take a deeper dive into the individual situations, say wrinkles, muscle attenuation, that type of thing. But this is just the basic format and the basic theory behind it. If you're interested in learning more, we are offering a Radiant Aging Summit. This is free. This is absolutely free for you on June 17th and 18th. Here's the link for it. It's the www.radiantagingsummit.com. And for those of you who are really interested in facial acupuncture and want to learn more, I am founding we founded this with the Pacific College of Health and Science. It's the FACE program. It's available. It's what's nice about the FOST program. It's flexible, virtual, and hands-on training with leaders in the field. This in 2022, it was myself, Matt Callison, Mary Elizabeth Wakefield, Deirdre Courtney, Michelle Gallus, Carrie Hart, all great names. What's also really nice about it is financial aid is available. The next round of classes begins in January of 2023, and here's the information in case you want to learn more about it. And it's a certificate program. It's 8 credits of college education and up to 96 hours of CDEUs and PDAs for the NCCOM, for Florida, California, including 2 safety and ethics classes. And you can always contact me through Instagram. Follow me on Instagram at Shellie_Goldstein. Or if you have additional questions, I'm always happy to answer them on hamptonsacupuncture.com. So thank you very much. Again, thank you to the AAC for allowing me to present today. Stay tuned next week for Sam Collins. He'll be presenting next Wednesday. He's always exciting, very interesting to listen to. And see you again. Thank you.